Okay, welcome everybody to the second in our 2026 webinar series, which is brought to you by the hearLIFE Centres and MED. Can I ask you please to rename yourself on your video? Last time we had some issues getting our certificates out to everybody. So if you could please just take some time and name yourself on your video, put your full name and your country, please. And that way we will know who we need to send certificates to at the end of the webinar. Thank you very much. So today our topic is children who receive their cochlear implants late. And we chose this topic because we know that this is a very common issue for us in the Southeast Asia region, which we all serve. So we've got two great speakers for you today. Our first speaker is Jia Chuan Lim, who's known to us as JC. JC is a speech and language therapist and a certified auditory verbal therapist. She's also certified in the Hannon approach. JC has over 15 years of experience in the field, and during that time, she's worked with many, many children who have received cochlear implants late. JC currently works as the principal auditory verbal therapist at the KK Women's and Children's Hospital in Singapore. Our second speaker is going to be Mrs. Sinta Nursimah. Mrs. Sinta has a very special perspective on this topic, as she is both a parent of a deaf child who uses a cochlear implant and a professional working at the Yayasan Aurica Foundation. I'll tell you some more about Mrs. Sinta before she begins the second half of our webinar today. So with those introductions done, I would like, it's my huge pleasure now to hand over to JC, who's going to give us a great overview of what we need to be thinking about when we work with children who receive their cochlear implants late. So over to you. Thanks, JC.
Thanks, Donna. Thank you for the kind introduction. And thank you, MED, for MED and hearLIFE to have put together a series of professional webinars like this to help us to grow in the field. Let me share my screen. Oopsie. Wait, just give me a second. It's always glitching.
It's okay, there's no hurry.
Okay, here we go again. Share. All right. So here's my disclosure. Like as Donna had mentioned, I'm now working in KK Hospital in Singapore. I'm invited to share this topic. No financial compensation received for this presentation. And I would like to highlight that the content reflects my clinical experience and the interpretation of the literature. So here are the questions we will cover today. I like to put my present. Sorry, someone have to mute the mic. So I like to put my presentation into question forms because I think there is no straightforward answer to when we work with children who receive their cochlear implant late. Let's look at our first question. What do we mean by late cochlear implantation? So JCIH, Joint Committee on Infant Hearing, has this gold standard 136. It means that hearing screening by 1 month, diagnosis by 3 months, and early intervention by 6 months. And we know that the current best practice is about early identification, early amplification, early intervention, and early CI when indicated. And if you can see the bottom there, the JCIH position statement in 2019, it says that cochlear implantation around 12 months of age or younger provides the best opportunity for age-appropriate spoken language development. So if early identification and early intervention is the gold standard now, what do we do when we see a child who receives cochlear implant late?